some degree. So we've had over 9,000 cases confirmed by PCR test in the last 2 weeks. For reference, on hospitalizations on May 30th, we had, May 30th, 2021, we had 582 active cases in the province, 585, sorry, with 53 of those in hospital and 18 in the ICU. So the case numbers are high, certainly very high as compared to what we're used to, but the variant is different. And the world is also different. So looking at the data to date, two things so far remain consistent. Number one, this variant appears less severe, but the volume is certainly breathtaking. And the second thing is the vaccines work to reduce severe illness. At this volume, things can change very quickly. That's one thing we've learned during this pandemic is there's no need drawing lines in the sand because the sand shifts very, very quickly. So Dr. Strang and I will be back on Wednesday. At that time, we'll have 2 more days of information, 2 more days of research and discussions. And while there are no new restrictions or changes for today, I would tell Nova Scotians we are watching and we will not hesitate to do whatever it is we think is necessary to keep Nova Scotians safe. So in the meantime, let's talk about the booster program. An incredible amount of work is being done to get boosters in arms. Today, we opened up appointments for vaccines to everyone over 30 who is over that 6-month NACI eligibility criteria for booster doses. So thank you to everyone who booked. You certainly came out in droves. Thank you for that. We had 92,000 new January appointments opened in the system overnight. I believe they're pretty much all gone, or maybe even all gone by now as I speak. That means some people are very happy. They got their appointments. Others are frustrated. But what I would say to them is more appointments are coming. Last week, we said that hundreds of thousands of January appointments would be open. They will. 92,000 were open today so far. The others are coming. The federal government has committed the supply to us. So we have enough for everyone over the coming weeks. The key to opening even more appointments than that number remains human resources. I want to thank everyone who has raised their hand and stepped up to help out delivering the boosters and the vaccines. We've had over, last count I had was over 1,000 individuals came forward to help. I can't thank them enough. Nothing says blue nose or spirit more than stepping up as you have, and I thank you tremendously for that. So right now, the team is working tirelessly to contact every one of those people who has put their name forward. And as more people come on board, more appointments will open up. It's that simple. So if you didn't get an appointment today, more will be opening regularly. So please keep checking back. We will continue to update you and give you as much notice as we can. If we see large chunks of availabilities opening up or new clinics, we'll let you know for sure. We want you to get your booster. The appointments will continue to open up daily. With that, I continue to put the call out once again. If you're someone with experience in immunizations, a healthcare professional, a nurse, a doctor, a dentist, retired, practicing, whatever, if you have the ability to help, please go to nshealth.ca /COVID jobs and reach out, and we'll be in touch with you for sure. Someone will contact you. So I'll now turn things over to Dr. Strang to talk more about exactly where we are and some perspective on that and maybe where we're heading. So Dr. Strang.
Well, thank you, Premier. Good afternoon, everyone, and Happy New Year to everybody watching. Given the very high case numbers that we reported over the last few days, the Premier and I thought it was important to have a briefing today just to help alleviate any concern or anxiety that we know often comes with such high case numbers. I'm personally not at all surprised by the case numbers, despite the hope that I had that we would have hit our peak. We certainly had more gatherings over the holidays, and those combined with a highly infectious variant was likely to lead to high case numbers. And that's exactly when we look at the timing of the onset of symptoms and testing. It's all consistent with people getting together. Even in small gatherings over the Christmas Day and Boxing Day, that's consistent. So we have to deal with that now. I'm not going to predict where this will start to level off. We know that Omicron is here and it is roaring through the province at a very fast rate, but no different than what's happening in every other part of the country as well. So we need to assume that it is everywhere and accept that it's much easier to catch and spread than any other variant we face. And as I've said many times before, the main thing we need to watch, and really is shifting our focus, is really on the hospitalization numbers, which the Premier has gone through. We still have our, while we watch the hospitalization numbers very closely, but the rate at which they are climbing compared to the amount of COVID we have is very much at a lower rate, and it's a positive sign that our ICU numbers, even though our overall hospitalizations is increasing moderately, that our ICU numbers are remaining very low and stable. So the healthcare system is managing the hospitalizations for now, but there are substantive operational impacts that are occurring throughout the healthcare system, from our EHS to hospitals to long-term care. And these are really from the hundreds of staff that are off because they are positive or isolating because they've been identified as contacts. And that's something I know everyone is worried about, not having enough staff and the right staff with the right training to care for those who are sick and vulnerable. And this is not just in healthcare. There are operational impacts that are occurring in most other sectors as well. Right now, people are required to isolate for 10 days if they have COVID, and close contacts, depending on their situation, have to isolate for multiple days and have negative tests. There is evolving new evidence on isolation times that the public health is assessing right now, today, and we'll have some final recommendations tomorrow that we'll be able to say more about at our briefing on Wednesday. We are in the most difficult stage of the pandemic yet. We are 2 years in. As everybody knows, we've had some form of restrictions and public health measures in place since March of 2020 here in Nova Scotia. Life was close to normal, in the fall, and then along came Omicron. There may be questions and some skepticism about how we're responding to the Omicron wave. I understand that this is very challenging and difficult. And it's quite likely that almost all of us have either had COVID, know someone who's had it, or been impacted as a close contact. Many of you may be thinking, and I've heard this sentiment out there, that no one is very sick, no one is dying. Why can't we just let this go and move on with in our lives? We could. That's certainly an option, but that's not one that I would recommend at all at this time, not yet. For most of us, the risk is low, but for some of us, the risk remains very high. And we need to think about people who can't get the vaccine, people who are already sick from other diseases or conditions or immune compromised, and older Nova Scotians. It's still very clear that the single biggest risk factor for severe disease is increasing age. We also need to think about the healthcare workers who will be caring for all these people. What if too many of them get sick? What happens then? So the things we have in place now will protect those who are most vulnerable in our healthcare system. But as you've heard me say before, it's about balance. Right now, we can't justify a stricter lockdown, but nor can we justify throwing the doors wide open. We can accept a fair degree of spread of the virus to allow us to continue to do some of the things that protect our mental and emotional well-being and minimize financial impacts, such as seeing small groups of close family or friends, going to the gym, attending school. However, we also have to work together to slow the spread of the Omicron variant to protect vulnerable people in the healthcare system. So we all need to step up and strictly follow the personal protection measures that are in place. I am hearing concerning stories about people's, feeling complacent because, well, nobody in their life has been severely sick. So what's all the big deal? It's about, as always, doing what's necessary to protect those who are most in need of our help and our protection for them. So stay home if you're sick with cold or flu-like symptoms. Wear your mask and wear it properly. Just a reminder, now we're recommending as a minimum that a 3-layered cloth mask, properly fitted and worn, is the type of mask you should be looking to use in the general public. Keeping physical distance where required and limiting your close social contacts also remain very important. And I would be remiss if I didn't mention the most important thing that we can do to protect ourselves and others, and that's vaccination. The Premier spoke about our booster dose rollout, and I do want to also thank the team for what's been accomplished so far. And I'm also proud that so many Nova Scotians have stepped forward to help with this vaccine program and build capacity, both those who can immunize and those who can help in other ways. And we'll need more people to come out in the days ahead to get the vaccine that we have into people's arms as quickly as possible. And again, I'm also proud that Nova Scotians are yet again prepared to do what it takes to fight COVID-19. The evidence is clear that vaccination reduces severe illness and death from the virus and is critical to protecting ourselves and others. Don't let anybody tell you otherwise. If we were dealing with Omicron without our very high 2-dose coverage rates of vaccine, we would be in a much more different and difficult situation. So our vaccination work over the last year is showing its dividends now, but we need to continue to layer on the booster. We can't just vaccinate our way out of the Omicron wave. We have all the other measures that I've mentioned. But as I said, our vaccination rate is one of the key reasons why now, despite high rates of Omicron, we have very low rates of severe disease. So the vaccine is working and it is protecting us. And getting a booster dose will maximize your protection. Your odds of getting infected, or if you do, of getting severely ill, decrease greatly when you have a booster dose. So those who are 30 and above, please, the many of you who have got an appointment, and the rest, there will be a lot more appointments for you, and please take advantage of that. Every person who gets a booster is another person who is optimally protected after 2 weeks from vaccination, and much less likely to get sick and transmit the disease. So again, if you're 30 and older and it's been 168 days since your second dose of vaccine, go online and look for an appointment. If you can't find anything today, keep checking back, because we're always adding appointments continuously as more immunizers and clinics get operationalized and come online. And there's enough vaccine for everybody who's eligible to have their vaccination this month of January. And please, if you haven't yet had any doses of vaccine, or your child hasn't, it's never too late. And we'll soon be reaching the point where children 5 to 11 will start to become eligible for their second dose. And that's equally important as well. Excuse me. With the amount of Omicron circulating in Nova Scotia, the chances of getting sick if you're not vaccinated are very high. And there's no guarantee that you'll experience mild symptoms, and it's simply not worth the risk when everyone can access a safe, effective, and proven vaccine. And I've been asked a number of times whether people who have tested positive for COVID can get vaccinated. The answer is yes. Anyone who has had COVID can and should receive their vaccine, whether it's a first, second, or booster dose, as soon as they've recovered, no longer have symptoms, and have completed their isolation period. And there does seem to be a lot of anxiety about testing and a belief that we don't have enough tests. We do have enough tests for everyone who needs one. We're just using them differently through this Omicron wave. People are showing up at testing sites to get rapid tests and getting upset when they can't get one. It seems people believe that they can access one rapid test kit per week. That's not true. You can no longer get a test just so you can be sure you don't have COVID. We ask you that you understand you need to go online or call 811 to complete a self-assessment. And if you meet the criteria, which are really based on being identified as a contact of COVID or having symptoms yourself, then you can book an appointment to either pick up a rapid test kit or get a PCR test, whichever you're eligible for. The system is responding to this pandemic, including testing at our maximum capacity. And we're balancing caring for patients and managing the highest risk cases with access to testing and vaccine. And so in any community, there's always a balancing going on by the health authority and then the IWK. So when we need increased access to testing or vaccine, or there's surge in care demands, NSHA is always adjusting their resources to respond to the greatest of their ability. So please know that we are closely monitoring the different demands, and when we see adjustments and more resources are needed in a certain area or in a certain area of focus, like access to testing in Cape Breton right now, for example, the health system will respond and respond quickly. And I want to end today by reminding people that we are Nova Scotia strong. January will be a tough month, and I expect that the Premier and I will have some more hard decisions to make. Omicron is pushing us to the limit and creating a difficult balancing act between controlling the virus and limiting the significant impacts of restrictions. None of this is easy, and we need every Nova Scotian, including us, the Premier and myself, to be at their best. Let these challenges bring out our finest qualities for all to see. We will get through this. Pandemics do end, so we will get through the pandemic. But let's get through it by working together, caring for one another, and treating one another with kindness and respect. The challenges we are collectively facing are manageable, and they are temporary. But the legacy we leave with our response will be permanent.